Hello friends, today we are going to continue with MRCS exam MCQ. Total 1500 MCQs, more than 1500 I am going to discuss in this series. So first MCQ 211 number MCQ I already discussed in previous session. So let's begin with a new MCQ. And MRCS playlist, you find all MCQs there. What is the role of inflammatory response in wound healing? To prevent infection, to promote fibrosis, to initiate angiogenesis, to inhibit collagen synthesis, to decrease blood flow to the wound site. So guys, if you want, you can pause this video and try to answer in comment section. So the single best answer here is to prevent infection. How? Let's see. Role of inflammatory response in wound healing. It clears debris and pathogens, prevent infection and releases chemical mediators and growth factors that activate fibroblasts and promote the proliferative phase of repair. Okay. What is the common complication of strangulated hernia? Infection, incarceration, constipation, bowel obstruction, or hernia reduction? So what is the best answer here? So before answering, you have to understand what is incarceration and what is strangulation hernia. In incarceration, there is obstruction of bowel and there is no ischemia or gangrene. But in incarceration, okay, this is the same. But in strangulation, there is obstruction and it causes ischemia to the bowel and causes gangrene and perforation. So best answer here is bowel obstruction is an early sign, gangrene and necrosis is a late sign of complication in strangulated hernia. So most common complication of strangulated hernia is small bowel obstruction because the trapped bowel loops blocks passes of intestinal contents. If untreated, bowel obstruction progress to ischemia, gangrene, and perforation. So early complication is bowel obstruction, late and severe complication is gangrene. And strangulated hernia, what is best treatment of choice? That is the one we can say exploratory laparotomy, urgent exploration. Okay. And how to diagnose by USG with the help of Doppler, and gold standard is CT scan, contrast CT, IV, oral and rectal. Now, describe the process of angiogenesis in wound healing, formation of new blood vessels from pre-existing vessels, or formation of new blood vessels from bone marrow stem cells, or increased blood flow in existing vessels, or decreased blood flow in existing vessels, or migration of fibroblasts to the wound site. So what is single best answer here? If you want guys, if you want to take time, take 60 seconds, not more. Try to answer in a 30 seconds. So best answer here is formation of new blood vessels from pre-existing vessels. Angiogenesis, new capillary formation from existing blood vessels, not from stem cells. It is a hallmark of proliferative phase of wound healing. What are the clinical features of perforated peptic ulcers? Sudden severe abdominal pain, gradual onset of abdominal pain, absence of abdominal rigidity, normal bowel sounds or stable vital signs or sign of peritonitis. So clinical feature is the best answer here is, guys, if you want, definitely you can pause this video, try to answer in comment section. So answer here is sudden severe bowel abdominal pain. Perforated peptic ulcer present with sudden severe epigastric pain radiating to whole abdomen, rigid board-like abdomen, signs of peritonitis and free gas under diaphragm on X-ray. You find this is the clinical signs. Thank you.